Hi, it's Patrick Hutzel here again from Intensive Care Hotline, and this week I answer another question of one of our readers. This week it comes from Graham from Portland in the USA, and Graham writes in, "Dear Patrick, my 54-year-old wife has had a bilateral lung transplant 18 months ago, and initially she was doing quite well and she had a good quality of life for the first 12 months after the transplant. We were traveling, she was able to exercise regularly, and she managed really well until over the course of the last 3 to 4 months when she became quite unwell. She has now been readmitted back to hospital, initially with shortness of breath and also in an infection in her lungs. A couple of days after being admitted to hospital, she had to be transferred to intensive care as her breathing was getting worse and she couldn't be managed on the ward. She has now been in intensive care for the last 3 weeks and she's not getting better. If anything, she's getting worse. Initially she was ventilated, and after a week or so they tried to wean her off the ventilator, but she failed and she ended up with a tracheostomy. So now she has been on the ventilator with a tracheostomy for about 2 weeks. It's terrible watching her, and she's mouthing that she wants to die. This is extremely upsetting and frustrating, not only for her, but also for me and our 2 adult children. Does she mean it, or is she just confused by all the drugs she's getting? It appears that she's getting weaker and weaker every day, and that she really is losing the will to live. The intensive care team is talking about the infection causing the difficulties breathing, and they have also mentioned rejection of her donor lungs, despite all the drugs she's on to minimize the rejection. I'm not the expert, but I have been shown some of her chest x-rays, and I even could see how bad her lungs on the chest x-ray looked. The intensive care team is quite positive and wants to continue treating my wife, and me and my children are hesitant, and we are wondering how much is enough. Do you think she will get better, or do you think we should start thinking about limiting or even ending her suffering?" Dear Graham, I'm very sorry to hear about your wife's and your family's ordeal. It sounds like your wife is very sick in the ICU, and it looks like she's not in a good position. First of all, unfortunately, it is not too uncommon that patients after an initial successful lung transplant are returning to intensive care with their condition deteriorating because of organ rejection and/or infection. Often one goes with the other. This is even more frustrating, especially since your wife has been enjoying a good quality of life initially. It's often the case that patients with organ rejection and/or chest infection after lung transplant end up back in intensive care only to find that the initial successful lung transplant was not as successful as everybody thought it was. Unfortunately, some lung transplant patients do come back to intensive care with organ rejection or infection, and then they end up with a tracheostomy and a long-term stay in intensive care. Those patients often approach the end of life in intensive care, and in some cases I have seen this to be over many weeks, if not many months. I think your question regarding how much is enough is a reasonable question. Keep in mind, however, that even though the outlook currently might be bleak, that you may want to give it a little bit more time before making such a major decision as if and when to limit your wife's suffering. Even though your wife is currently very critically ill, she may improve, and if she's getting better, she will probably also find the will to live. It is difficult for me to say whether your wife is serious about wanting to die. However, most patients in intensive care, especially when ventilated and sedated for a prolonged period, tend not to remember anything about their ICU stay. Having said that, it doesn't mean that your wife isn't serious about wanting to die and having enough about the situation she is in. It's a very difficult situation, and there are often no right or wrong answers, as those situations often tend to be grey in nature. If your wife's condition will be improving, you and your family will be glad that you continued treating her, and if she deteriorates further, you might feel guilty that you and your family haven't stopped her treatment in cooperation with the intensive care team. Also, think about other situations in your wife's life where she has been dealing with adversity. How did she do? I think the answer to that question will give you an indication of what to expect and what decisions you should make. As a rule of thumb, stay positive and support your wife as much as you can. My advice is that you should give it a little bit more time and see how things progress, and then make a decision from there. Continue evaluating your wife's response to what she's going through, and since you and your family know her best, make a decision from there. All the best, Gray. If you have any questions regarding your loved one's stay in intensive care, send me an email to support@intensivecarehotline.com. Also, in order to learn quickly how you can take control, have real power and influence decision making while your loved one is critically ill in intensive care, enter your email below and get your free instant impact report so that you can learn instantly what you need to do in order to take control of the situation and have real power, and so that you can influence decision making. When you're entering your email, you also get 4 more free reports. 6 questions you need to ask the most senior doctor in intensive care. The 7 most frequently asked questions whilst your loved one is critically ill in intensive care. 10 things you didn't know doctors and nurses are talking about while your loved one is critically ill in intensive care. And 9 myths of being a critically ill patient in intensive care. I'll see you again next week, and thank you very much for your time.